right. So welcome to the session from COVID Hero. This one is on healthy connections. So we're going to be talking about social relationships and friendships and strengthening those. Real quick, we will introduce ourselves in case some of you haven't seen the previous ones. My name is Kerr. I'm a clinical psychologist and a researcher at OSU, and I've done a lot of work at Liber with Robin and Namik on their resilience training and interventions.
I'm Robin Aupperle. I'm a licensed clinical psychologist as well at Laureate Institute for Brain Research, and most of my work is focused on anxiety and depression and treatments, psychological treatments for those. But like Kerr alluded to, we've also worked on developing programs that can help optimize functioning for people who aren't experiencing specific mental health symptoms, but just more focused on helping deal with life stress or transitions. And so that's what kind of led us to develop the COVID Hero program to try to do our part to help support healthcare workers that are dealing with stress from all the different things that are happening during this pandemic.
And I am Dr. Namik. I'm also a licensed clinical psychologist and a researcher here at the Laureate Institute for Brain Research. My work has also been with anxiety and depression, and I also focus quite a bit on experiences of early life stress in adolescence, and also developing resilience building interventions together with Robin.
So a lot of these aren't as relevant for just watching the recordings, just some caveats to start out with. But the main thing is just be aware that these are just kind of informational and resilience focused. They're not intended to be any sort of psychotherapy or treatment or assessment for any mental health disorder. So if you do have any of those issues crop up, feel free to use some of the numbers on the screen or reach out for mental health services, but these are more just informational, educational sessions. Is there anything else I'm missing on this, Robin or Namik?
No, just don't hesitate to reach out to us at the neurocat@laureateinstitute.org, and the number listed there, the 581-4885, if you'd like any specific referrals for treatment.
All right, so this is just the list of all 5 sessions that we have with the COVID Hero program. I think there's also an introductory session as well, but these are the main content sessions. So as you can see, today is the Healthy Connections. So just so you're aware, these other ones are available as recordings. So some of these might be more or less relevant for you or more helpful to you. So they're kind of standalone. You don't have to watch all 5 of them. But if there's any other ones that interest you, feel free to find those recordings. So just as an intro to this session, anytime there's a stressful or upsetting experience, it can affect relationships with friends, neighbors, coworkers, family members. I think this is especially pertinent given that the pandemic by its nature has disrupted a lot of our social relationships and a lot of the way that we socialize with other people and spend time with them or not. But we also know that healthy relationships and connections are really important for our well-being. It's kind of one of the main things that makes us human is our social connections with other people. And so it can really affect both our mental and sometimes even our physical health if we aren't maintaining those connections. So that kind of motivated us to include this as one of the sessions in our COVID Hero program. And especially given the unique nature of how this pandemic has disrupted social relationships, we thought it was really important to focus on ways that we can still maintain social connectedness despite physical distancing and other things that might be getting in the way. So we're going to cover some skills that could be useful in maintaining positive relationships and community support. So even though there will be some focus on COVID, the skills here can be helpful just anytime to help maintain connections, and also just anytime you're going through any sort of stressful situations, ways to maintain relationships with others. So did you all have anything to add before we go into the video?
Nope. Insert that we do use videos throughout a lot of these different COVID hero sessions, so that it's not just us sitting here talking to you. But we do not necessarily endorse any of the companies that might be highlighted in those. We are selecting them based on the content, not necessarily for marketing purposes or anything. But I think those videos were really good at kind of honing in on the importance of social connections for humans, and how important it is to focus on and try to support or try to enhance during the pandemic.
And just to kind of add on to the video, because it was really focused on like the effects of physical distancing and social distancing, but there are other ways that the pandemic might have disrupted your social relationships. So one way could be just that you feel like, well, everybody kind of has their own struggles that they're going through right now, so I don't really want to burden anybody else with what's going on with me because everybody's kind of got their own stuff going on. Or it could also be that, you know, it might have brought about differences in comfort level as far as ways to socialize, and also differences of opinion are quite common currently in our environment. So there are lots of different ways, not just with social distancing, but just affecting the relationship more directly as well. So hopefully this session will help you kind of reflect on those things and ways that you can kind of move forward with healthy relationships in spite of those things. But any other comments from the video, Namik or Robin, or?
Maybe just to add in that, you know, even at times, say like at work, so as healthcare workers, you know, it just, even the people that you're used to interacting with and maybe that you're still kind of around on a regular basis when you're working, it might still be changing how you're interacting on a regular basis that could make us feel more distanced. So we might be, you know, having full PPE on, you know, more often than not. And so we're not able to see the person's face, which I think for humans, face processing is actually very important, and being able to see facial expressions and things. And so, you know, even just some of the other safety precautions that are helping battle COVID also can kind of get in the way of this. So yeah, so we've definitely got to be creative, and just, I think, being aware of all the ways this might be influencing our ability to feel connected to others is an important start, so that then we can identify creative ways to get around that.
Mm-hmm.
Yeah, and so with this session, we really wanted to go over some things that are important for social support and developing social support. And the way we structured it was to talk about what kind of social support types there are and what they mean, and then also kind of think about, for each of us individually, who is available to us in this very moment that we may be able to lean on and rely on for different kinds of support. And then we also wanted to talk a little bit about what it looks like to be giving and getting social support from folks around us across some different steps. So that's really what the next few slides will cover. And so without further ado, we'll talk a little bit about the types of social support that exist out there. And so one being the emotional support. And this really has to do with us feeling heard and understood, cared for, loved by others, accepted. And what that means is, also listening to others, actually, and giving a hug or shoulder to cry on, being there to provide advice if needed, but without judgment, and just simply listening when we need to. The other one is social belonging. And so this has to do with feeling that we fit in, that we belong, and have things in common with other people. And it also means spending time with friends and family members, participating in enjoyable recreational activities with others. And while this might be something that's hard right now in the current situation, it also means looking for other ways to achieve this. And so whether it's while practicing social distancing or physical distancing rather, or while maybe using technology to feel like we're still part of our group. Another type of social support is feeling needed. So we prefer to feel that we are important to others and valued by others. And we can also show others about this by that they are needed, that by expressing words of appreciation or gratitude, or letting them know that we appreciate their company. Self-worth is another type of social support, and this has to do with feeling that we are valuable and appreciated by members of a family group, or a family, or members of a group, or even an organization that we are a part of, that our contribution makes a difference. This can be something like knowing that we want our respective employers to notice that we're doing a good job, or that they're appreciated, that they know how instrumental we are for the work that's being done. And if we're in a position to do that for others, it means, again, engaging in acts of appreciation for someone's skills or knowledge or talent, and then asking folks to participate in things, or us being asked to participate in things, etc. Another type of social support is advice and information problem solving. This has to do with having someone available to us who can offer good advice. So if we are struggling with a particular thing that someone has experienced before, for example, buying or selling a home, someone might be able to give us advice on the things to look out for, things to pay attention for, who else to contact if we needed something. This could be a mentor or a colleague who has dealt with a particular difficult situation, or a difficult patient, or who's gone through this before. Someone who can help us think of other options, ways to fix a problem. Reliable support it has to do with feeling that we have people we can depend on to help us if we need that. And so these are folks we know are always there, or will be there for us if we called them, if we reached out to them. And also being reliable support is being available to someone and letting them know that we would be there for them if they needed something. Physical assistance sort of speaks for itself, but this has to do with having folks in our lives who can carry out physical tasks or our errands for us, or help us achieve those kinds of things. So if we need a car fixed, or our loan mowed, or running to the bank, or help us with the groceries if we are kind of in a bind, or helping us with paperwork or filing taxes. And at work, if we're learning a new charting system or record keeping system, someone who can really kind of help us with those kinds of things. Material assistance finally has to do with having people giving tangible assistance. So this can be things like food or clothing, or medicine, or a loan, financial assistance. So these are specific tangible things that that folks can provide, or we can provide to others. Any comments from Robin or Kara?
Some thoughts popped up. I think some of this might overlap with what we're going to cover in the next couple of slides, but obviously one important thing to note here is that some of us might be really lucky to have like a few people that cover all of these bases, that actually hit all of these. But most of the time, we're going to have different people who are the relationships with them provide different things. So I can think of family members who I don't necessarily confide in that much for emotional comfort, and I might not even feel like we have the same kind of outlooks on the world. So I don't really feel like we have a great social belonging, but yet they're reliable, and I could call on them for anything, and they would provide the physical and material assistance at any point if I needed it. And so, there's going to be different relationships that provide different things. The other thing, and I know we'll probably kind of get to this, but I think recognizing these different things are super important to all of us humans, it then makes us perhaps respond differently or reach out differently to other people. So if we think about it as it's important for people to feel needed, then that might make us more likely to reach out for help when we need it, because that's not only going to be helpful for us to get that help, it actually might be helpful for that other person to make them feel needed, and make them realize their self-worth. And so, those connections are important. And so it's important for other people as well. So I think to increase a lot of this for ourselves, a lot of it is giving it to other people, because relationships are always bi-directional. So anyway, those are just random comments or thoughts that came to my mind.
Yeah, and so that's great, because it can also help us kind of identify who we might be for others in these areas. And we'll talk a little bit about both kind of getting and giving social support and help. So next thing, we really wanted to create a quick exercise here for everyone listening or watching the videos later. And these are just a list of type of people in our lives that typically we have, from immediate family and coworkers and other folks that are that can be part of different organizations, or where we work, or agencies and community organizations that we're involved with. And so these are types of folks who potentially could be in our lives. And it's kind of an exercise just to think about who is available to us right now in this very moment for any type of social support that we might talk about. So we want you to take a moment and just to look at this list and identify for yourself and jot down who is available to you in this very moment, or might be in the future. But even though it says right now, you can think about who are some of these folks who might have been available to you in the past, that you might be able to call upon now or in the future. Someone you might have lost contact with or have not been in touch recently, but who has been a form of social support for you. So just some ideas, and then simply kind of jot them down and figure out who might be there for you, and take note of that, because this is something that might be helpful to us as we build what we call a social connection map. And so this really has to do, and I think this is a little bit out of order, so I apologize. So and this cloud over here on the left of the slides, you want to write your name in the center of that circle, and then write the name of the people or pets or professionals or organizations that are part of your social networks. And you can add more clouds if you need to, or more lines. And so we jotted here everything from our spouse and a parent and a child and a sibling and a coworker, college friend, even your yoga instructor or your pet who might be social sources of social support for you. And if you can think of other folks, just go ahead and write that down for yourself. It's part of that map. It's part of that connection map.
And I would encourage you to be very inclusive here. So I think, as Namik alluded to, not necessarily just right now, but like if you've ever been able to rely on them for anything in the past, or you think you might be able to in the future, include them. There might be people that you think to include, but you've had recent conflicts with, so the connection has been severed a little bit, but perhaps still include them as, a potential, as part of that social connection map. Even if it's something like, even if you feel like you need to strengthen that connection, it's still, I think, important to have them on this map to help you think about that. So try not to exclude people from your map for, if you think, even if it's a little bit of a weak connection right now, I would still kind of include them on there.
Yeah, if they pop up for you right now, put them on a cloud. And then you can sort of sift through, and because the next part of this exercise is really going to kind of get to that. The first part is to brainstorm and jot down as many as you can, and then we can think about really, which different people in the relationships provide different types of support, and then we can look at our social connection map to see who is there for specific kinds of things. So the first thing is, who is the most important connection right now for you? And these may be the people you spend most of your time with, and these may be the people in your immediate family. But go ahead and write down who that is. Who is your person? Who's the most important one for you? And that might be your partner, your spouse, husband or wife, or your child. And again, think back at different types of social support. Some folks will be able to provide some things, others will be able to provide different kinds of things. But if your spouse might be there for emotional and material support, but a child might be just there for support emotionally and to have fun with, right? But they are important. The next thing is to think about, with whom can you share your experiences or feelings, and think about who is there for you when you need to vent or talk about what you're going through. Who will listen, who will not judge you, who might just offer a shoulder or a hug for you, and you can enjoy those.
A virtual hug or
Virtual
shoulder.
hug, yes. Yes. We've talked about before how these skills transfer beyond pandemic, but definitely currently. But also, there may be people you are not socially distancing with in your family that you can get from. But if it's somebody like at work, maybe just a virtual hug. And then, who is there that you can ask advice from to help you with some kind of like recovery from stress, for example. This is what this alludes to re-energize, to recuperate. So this, you maybe take your dog might be that connection for you, because you can take them out for a walk or a run or go hiking with and your yoga instructor or some kind of a coach or a mentor, or your if you have a physical therapist or somebody at the gym or something like that. And then who might be able to help you with practical tasks like errands and paperwork. And so the reason we have this as blank is that this person might be missing for you right now, that you are having a hard time identifying, well, I have no one really to go run an errand for me or to help me with the difficult paperwork or difficult tasks or with a new system I'm learning or whatever. And if you're struggling to find someone in that area, that's okay too. You can kind of look back at your social connection map and think through, well, is there someone? Is there maybe a coworker or a friend that I could lean on if I needed something quickly done? Like if I'm staying, if I have a late shift and I need my dog let out, is there someone who could do that for me? So if any of these you're struggling with, you might be able to either look back at your connection map and replace and add them in, or this is a good way to identify, okay, this is the area where I need some support. So what are some of the ways I can go about looking for that area to be completed as well? And then the last one, who might need your help or support right now, because this is about both getting social support and in giving, who are the folks that may be that you are the most important connection for right now, and go ahead and identify that as well. And so the questions also that might come up are, not just what types of support might be missing, but are there loved ones or friends with whom you wish to reconnect from the past that you've had great relationships with? Are there people you would like to spend more or less time with? Are there some relationships that you would like to improve upon? Are there folks you would like to help out, but you aren't sure about how to go about it? Are there types of social activities you'd like to have right now that you will need to think through because of the situation that we're in? And so now you really want to kind of come up with a concrete plan for what you're going to do and when you will do it. And we had a whole session that you can watch a video on if you haven't already on problem solving. That is a perfect kind of set of skills for this. What we're talking about right now is to sort of if the problem is that you would like to spend more time with a specific person, but you just don't know how to go about it, you can rely on that session to identify some ways and how to set a concrete plan and set a goal for yourself and how to put that goal in action and achieve it. So come up with that concrete plan. You can use that session, or if this is something you already have done before, and then plan it and put it in action, and then see how it's working, right? And check for yourself whether any changes or adjustment need to be made, and then incorporate those as well. Any additional comments, Robin or Kara?
Of course I do. So one, I mean, I think, the problem solving, and kind of that, summarized in there in terms of like, you brainstorm, you come up with a plan, you put that into action, you check out how it goes, and then you kind of reevaluate and you might try again in different ways. I recognize that in the social domain, because we're all humans and because social connections so important to us, that I think sometimes that can be more anxiety provoking for us to try out a plan socially of, I want to connect with this person more. So I want to, what are ways I can connect more with them, and how can I reach out to them? How can I tell them I'm struggling, or how can I tell them I kind of need someone to lean on right now, or how do I offer help to them, and how do I do it in a way that, and having, a lot of times we can have all these thoughts in the back of our minds of like what could potentially go wrong there in terms of whether they don't want to connect more with us, or whether they withdraw more, or whether, we say things the wrong way, or whatever it might be. I think all of us have these kinds of social doubts in our heads that sometimes make taking action on this harder. And so recognizing that, and I think it is useful to brainstorm all the different ways that you could go about connecting and finding what you're most comfortable doing. So finding the thing that you're actually going to put into place, right? So, you might think, oh, I should just pick up the phone and call this person, but you're not comfortable with that yet. Oh, I'll just text them. It's probably better to take the action that you'll actually take rather than saying, well, I need to call them. I shouldn't text them. I should just call them, but then you don't do it because you're never quite there yet. So kind of striking a balance between, what is realistic for you and what's a realistic goal, trying it out, seeing how it goes, brainstorming a lot of different ways to connect with people. I don't know if Kerr or Namik, you have any other thoughts to say kind of about that, but I do think that's kind of an important obstacle to recognize, that a lot of times we're more hesitant to try out different things socially with people than maybe other problems.
Yeah, I think, right, because of social anxiety potentially, or because, it's sometimes easy to convince ourselves, well, people are busy and they have enough on their plates and they have enough going on. I think it's sort of easy to withdraw a little bit. But I think it's social connections are inherent to us as humans, and on some level, most of us enjoy them. There's a lot of conversation about introverts and extroverts out there, but there's this misconception that introverts don't like to spend time with people, and that's not the case. They do. They might prefer smaller groups rather than large gatherings, and that's okay too. So, this is really meant to kind of think about, who you are and what you would like to do, and then reaching out. And you might be surprised what the response is, simply because other folks may be looking to reconnect as well, or connect. I think what's hard right now is that given that we are asked to socially distance, given that there are restrictions on what kind of events and activities are happening, this has added some additional stress on relationships. But I think they're also important as they ever might have been. And so we all need to be thinking about creative ways to maintain social connections and social support. And I think the important thing to remember is that not all of this falls on each of us individually. We can brainstorm with our friends and family members on how to do this and get input from them, and build these approaches together as well. So we don't have to be the ones that figure it all out.
Right. And I think and you'll kind of get to it, I think, with the 6 steps on the next page, but I think, even the very smallest of things can go a long way. So like we might think, it probably can be daunting to be like, oh, I need to, I don't have any really important connections right now. Like I have all this informational, advice giving. I have people like that, but I don't feel like I have any meaningful connections. Well, that can be pretty daunting to think of, like, oh, I need to find someone to build an important connection with, and that can be very overwhelming. But if you just think about, I really would like to build a better, stronger connection with this person, I'm just going to reach out and just see if we can chat, or video conference once, or just text them and tell them I'm thinking about them. And I honestly feel like I've probably gotten more texts like that since COVID has happened than I ever have before, just because people are feeling this need to connect. And so it's kind of expected right now, but just those little things can actually make a big dent. It doesn't have to be these huge, complex plans in terms of building these connections, just small steps.
Yeah. And so speaking of steps to getting and giving social support, you've already been thinking about basically, some of this and asking these kinds of questions already. So we've already kind of gotten over the first steps. So basically, who are my most important connections right now, and related to getting, and then giving support, what kind of problem is the person facing? And so what I'll do is I'll talk about getting, and then we can move on to giving support. But the next step in getting support is also understanding what is it that I want. So deciding what I really want or need from a social connection. Do I need someone to just listen to me as I vent about my day, or am I looking for advice? And so kind of thinking like, okay, this is what I want there to happen. And we can look outside ourselves and ask the question, what kind of problem am I facing? What kind of support will help me cope? Are they more the decisions that I need to be making? And do I, what is it that I need from another person in this situation? We can also look, and kind of think through our feelings and what is it that's going on with us, and establish based on those things what kind of support we'll ask for. The next question is, choosing the person that we're going to ask for help from. And so thinking of, based on my connection map, who is a good support source for the thing that I need? Have they given me this type of support in the past? Can I depend on them right now to do the same thing? And can they have the time for this right now as well? And then thinking through is also like, when is the right time? When is the right place? You'll be talking about something that matters to you. So, you want to make sure that the person has enough time to listen, or that we have time to do this as well. And so setting yourself up for success here, and making sure that as we're setting the situation up, that it will work, and that we remove any potential barriers and obstacles. Requesting things with an iMessage. This is one of those good old skills when we teach in communication. But once we've set up these other steps, using an iMessage to talk about how we're feeling, what our situation is, and what the person listening to us might be able to do to help us. So, you might be able to say, like, I'm really upset or frustrated. What happened at work today? And I wonder if we can talk about it. It's something as simple as that that can help us start the conversation. And because we talked about the form of social support and acknowledging other people's worth, thanking the person is the last important step here that allows us to recognize the person who has provided us that help. And I think it's one of those things that maintains the relationship and can improve relationships over time, is showing gratitude for that person. Any comments on getting social support before we move on giving social support?
Of course. So it's just going to be an ongoing joke throughout every video. You'll see this. Robin always has to say something. But I was just thinking, like, that it might be too that relationships that we have that are important to us can get strained during really stressful times, just because everyone's more stressed. Everyone has, kind of more things on their plate to worry about. And so I just, the requesting with an iMessage, I think, can be crucial, particularly in, like, perhaps relationships that are a little bit strained, so that it's not, you're never there for me, or you're not available, or you've withdrawn, instead of saying, I feel less connected to you, or I feel like I need your help more, or I feel this way, can bring the connection to you, make that connection stronger than the kind of blaming and saying they or you, but focusing it more on what you yourself kind of need and are wanting, kind of brings people towards you rather than pushes them away. So I think that's a useful message. I do think when is the right time and place. I think that's important. And like Namik said, trying to break down any obstacles so that it's as easy as possible and doable. But also recognizing that sometimes there might not ever seem like a perfect time. Perhaps picking the best time, even if it's never feels exactly perfect or exactly right. Yeah.
Great. And so thinking about giving social support, it's, we start with kind of thinking through what the problem is for the person and what they're facing. Is this something related to how they're feeling right now, like being sad or discouraged or stressed out, upset, what's going on with them? Or is it something that needs fixing, like the car can't start, and what might be the problem that they're facing, and are they in need of someone to help them with this? And then it's also important to identify what is the support that we can give to be helpful. So it would be a mistake to ask me to help you fix a car, for example. So and I need to know that about myself, as that's the kind of support I would not be able to do beyond, you should call AAA, right? And so we want to think through what we are able to do for that person. Are we helping them directly with the problem, or do they just need to be heard, or maybe go to a movie? Well, not right now during the pandemic, but maybe we just need to Skype with them or FaceTime and hear them out. Although folks have been watching movies together from where they turn on their FaceTimes and they watch a movie together from their respective homes. So it is possible to see a movie together still. But anyway, as you're thinking through this, we want to make sure that we avoid doing more than we can handle, but obviously providing that support. Finding the right time and the right place are also important. We want to check with the person and see if they, when is good for them, but are we also able to be there for them during this time, so that we are able to give them our undivided attention. And the same thing goes for a place and space, making sure that this is an environment that's safe and comfortable, and that there's privacy if that's needed, to where they can share things with us, where we can help them. I think sort of often this step is missed, or it's implied, but we want to show people that we're offering to help. We want to explicitly offer that help. Folks are often, ourselves included, are hesitant to ask for help, or maybe too shy, or they don't want to impose, or they think we're too busy. So if we are recognizing a problem in someone, and we are able to help, simply offering that so that they are aware of that. And if the person agrees to receive the support, we want to provide that help in a sensitive way. So that really means paying attention to what they're actually asking for. And if they simply want us to listen, then we just do that. If they want practical advice, that we offer that as well. And then if, watching to make sure that we're not providing judgment or criticizing how they might have gone about doing those kinds of things, and really doing that in a way that's sensitive and supportive. And also being gracious when they thank us, and accepting that as well. Robin?
No, I actually don't have anything this time.
Sarah, do you have anything to add?
Well, since Robin is at a loss, I was just going to say, like, as healthcare workers, especially right now, you might feel like you're giving kind of all of the time, that like every single day you're spending hours and hours giving, which is true. So it might be hard to kind of find the motivation or the time or the energy to kind of do that in your personal relationships. But I think you might find if you can even just do some like small things for friends and family members, that it'll be really beneficial to strengthening those relationships and might result in kind of more personal satisfaction, because you can really see how that benefits them and the effects and their appreciation and things like that. That's it.
Yeah, absolutely.
Yep. And that did bring up something in my head, but yeah. Well, a couple things. So, one, because I know, because sometimes it can be difficult to say, like, I need help with XYZ, but like one example I can think of is, with it, as a mom, all my examples have to do with kiddos, it seems like, but in the, in the fall, I think a lot of us are concerned right now about schools opening and what's going to happen, and if schools are going to close temporarily, and like what all is going to happen, of thinking through, like, okay, who can I call on if I get into a situation where all of a sudden my kids can't go to school and I have to go to work, like, who can help me? And I know there's some neighbors that I think, would probably step up and help watch the kids for me if I needed to, if I was stuck. But sometimes it can be, less easy to ask someone and say, saying, what, I really need someone to be able to watch my kids when I'm, when I get in a tough place. But sometimes, for me at least, it can be easier sometimes to say, what, if you ever find yourself in this position, like, please call me and my husband, we'd be definitely willing to, take your kids if at any time, and if you don't mind, I might call on you to do the same, kind of thing. So it's like you're offering to give help at the same time as getting the help. So it's creating this kind of bi-directional relationship. And so you might be giving of yourself, but it's not just a one-way giving, that it's something that, because at work, I feel like, especially as healthcare workers, or as, a lot of that help might be one way. Whereas the outside, the other social connections are important to build, that it's not just the one-way help, that you're getting help to. But,
yeah.
Yep.
So as with other sessions where we mentioned, this is the overview again of the COVID Hero program that we created, and there are where we basically set up various sessions to help us identify and optimize skills to manage stress related to the pandemic we're facing, and feel free to sort of peruse those sessions and check out what you think might be something that might be helpful for you. If you're not watching all of them, if you don't have time to watch all of them. If you have any questions and if you would like to contact us, go ahead and do that. We have the contact information at the very beginning of the first slides and in the descriptions of the videos as well. And with that, we will wrap up for today.